Greetings. Happy World Heart Day. My name is Goodarz Danaei. I'm serving as the faculty director of the Bernard Lown Scholars in Cardiovascular Health program here at the Harvard T.H. Chan School of Public Health. Thank you for joining us today to honor Dr. Bernard Lown by unveiling his portrait. We chose the World Heart Day to have this ceremony to acknowledge his contributions to the field of cardiology and cardiovascular health. And we have chosen to do this in the Department of Global Health to celebrate his contributions to humanity. For our ceremony today, I'm joined by three distinguished colleagues. First, we'll hear remarks from Dr. Vikas Saini, the president of the Lown Institute. Then we'll hear remarks from Professor Marcia Castro, the chair of the Department of Global Health and Population, followed by Professor Jane Kim, Dean for Academic Affairs. Without further ado, I'll ask Dr. Vikas Saini to make his remarks.
Hello, everyone. Firstly, let me thank Goodarz for inviting me. It's a pleasure to be with you today, though I'm sorry that it had to be virtual. The first time I met Bernard Lown, I was his chauffeur. As a medical resident, I was one of the leaders of the Baltimore chapter of Physicians for Social Responsibility, and it was my duty to pick him up at the airport. We had a lovely chat on the way. He was a keynote speaker for our major Hopkins Symposium on the medical consequences of nuclear war. Years later, he remembered me. I'd secured a position to train in cardiology and epidemiology at Hopkins, and I called him up just to see if I could come to his lab for 3 to 4 months, learn some techniques, and return to Hopkins. He absolutely, categorically refused. The only way he would let me do that is if I transferred from Hopkins to Harvard and became his fellow, which is what I did, which is how I got to Boston. I was lucky I made that decision. I spent many, many years with him, first as his student and trainee, then as a colleague, and finally as a friend. What was most remarkable about him was how completely integrated he was. He had what I think of as a gloriously holistic view of the world, particularly of the connections between medicine and public health. Though first and foremost, he was a clinician, and that's important to remember, because for him, the human interaction between the doctor and the patient was almost magical, and that was the bedrock of his entire worldview. How did he end up at the School of Public Health? That's a story worth knowing. It happened during one of the periodic waves of political hysteria in America, when he was shunned by Harvard Medical School because he'd refused to sign a loyalty oath. That's when Paul Dudley White and Samuel Levine persuaded Fred Stair to take him into the Department of Nutrition, kind of as a political refugee. And what a bargain Stair got. The work that rocketed him to global fame, of course, was the development of the defibrillator, which happened in his lab on the first floor in Building 2 of Nutrition. When he couldn't get any useful results from a grant-funded project on fiber optic angioscopy, this is the 1950s, he took a small amount of those funds and did something on the side, collaborating with another European refugee immigrant, Baruch Berkowitz. They refined the idea of something from the 1930s in the Soviet Union, which was the use of direct current to defibrillate the heart. They successfully implemented it. They operated at breakneck speed 7 days a week, using dogs on multiple experiments a day, and went in about 8 weeks to figure out everything, one explosive discovery after another. They worked out all the basics, the delivery energy, the shape of the waveform, the paddle positions, the precise timing, everything. And then Dr. Lown persuaded people to let him try it on humans in the operating room. He told me he used to take this experimental device in a cart, it was probably about the size of a small refrigerator, and roll it down Shattuck Street to the Brigham. Within a few months, this was worldwide in its use. The spectacular success of the defibrillator also then made the coronary care unit an absolute necessity. So he built the first one in Boston. He got the chief physician at the Brigham to say yes to some space, and then went and convinced the construction crews that that meant a whole wing of one floor of the hospital. Then he raised the money himself, because there was absolutely no budget for this new concept of coronary care. That was Bernard Lown, an iconoclast who would not take no for an answer. When he knew he was right, he could be a man of ruthless action. In fact, he once confided to me, "I have a surgical mentality. It disturbs me." Unlike many surgeons I know, Dr. Lown was actually a true and intimate long-term friend of many, many of his patients. And that created a powerful presence which promoted healing. There was no doubt about it, and any patient who experienced that was lucky indeed. The portrait that we're unveiling, I think, captures all of that. When I commissioned it with my good friend, Nasib Shamoun, whom I had originally met as a fellow in the Lown Lab in Building 2, we chose Steve Coit as the painter. Steve was the first venture capitalist to invest in our startup device company. 20 years later, when I learned that he was now a VC painting portraits, I didn't have high expectations, to be frank. After all, this was a guy who majored in computer science as a Harvard undergrad and then went to the business school and started investing in technology. But once I saw the portrait, wow, I was so delighted that we'd made that choice and given him that commission. It captures his fundamental belief that without action, we risk helplessness. But with action, there is always hope. What does the portrait mean to the Harvard School of Public Health? Well, certainly it's a tribute to Dr. Lown and an embrace of him by this institution. It's also a sign of his affection for this institution and his gratefulness to have found a home here when no other would have him. But it really wouldn't be true to Bernard's beliefs if I didn't say it should also be a challenge to this school. Despite all his affection, Dr. Lown always felt that Harvard was not living up to its potential to do good in the world, whether in relation to the needs of global public health or to the needs of communities just a few miles away. So I hope, looking upon his portrait, generations of students and young faculty will feel challenged and will be inspired by this image, by his image, to remember the world beyond the ivy walls, a world of human beings who are hurting. I know that concern was at the top of his agenda when he asked me to develop the terms and structure of the Lown Scholars Program, so I'm delighted to see that it has now grown and is flourishing under Goodarz's capable leadership and is a worthy realization of his vision. This is a portrait of one of the greatest physicians of modern times. I hope it will inspire all of us to emulate him, to absorb some of his iconoclasm, some of his moral fervor, and most of all, his unwillingness to tolerate norms that are oppressive and unjust. That would be the greatest and best tribute to him that we all could give. Thank you.
Thank you, Dr. Saini. Over to you, Professor Castro.
Thank you, Goodarz. I'm delighted that we gather here today to honor Dr. Lown's work, public service, and legacy. Let me say a few words about Dr. Lown's impact on global health, leadership, and social activism. In addition to the life-saving innovations that he pioneered, Dr. Lown worked to overcome political tensions in the mid-20th century, connecting medical professionals across borders. He sought to create a truly global network of cardiologists, emphasizing the inclusion of all countries. A primary goal was to identify and share best practice of prevention and treatment, and to share this knowledge with everyone without regard to ethnicity, religion, income, or politics. This included traveling multiple times to China to create doctor-doctor relationships, providing journal subscriptions to doctors in Cuba, paid for out of his pocket, and developing relationships with physicians in the Soviet Union during the Cold War by using satellite simulcasts so US and Soviet physicians could interact. Dr. Lown established Satellite, creating a satellite-based global health communication system as a means of demonstrating that space can unite rather than further divide humankind. With Satellite, medical students and professionals in developing countries were able to access literature, documentation, and peer knowledge for their work. He then established ProCore, an international network of cardiology and public health communications by internet, and similar communications to assist colleagues in poor nations to access the latest medical knowledge, especially in cardiology and relevant measures on public health. Dr. Lown's contributions to global health through his leadership cannot be overstated. His perseverance to preserve public health in all facets inspired generations, and countless health professionals who followed in his footsteps were made all the more successful thanks for his tireless activism. I want to end with a quote from Dr. Lown. Some of life's biggest and most positive changes are propelled by mini conspiracies of a few well-meaning folks. Dr. Lown's mini conspiracies promoted and continue to promote positive changes. We are delighted to honor Dr. Lown, and I would like to thank Dr. Goodarz Danaei for leading the Lown Fellowship Program and continue to spread Dr. Lown's ideals and mini conspiracies. Thank you.
Thank you so much, Marcia. Over to you, Professor Kate, please.
Thank you. Throughout his life, Dr. Lown remained committed to fighting against acts of injustice and for the betterment of humanity. During the Vietnam War, he helped to found the Committee of Responsibility to save war-burned and war-injured Vietnamese children, to transport and provide US-based care for almost 100 children under the age of 16. He was an advocate for the prevention of nuclear war, and in 1961 became the founding president of Physicians for Social Responsibility, or PSR, a nationwide disarmament organization supported by thousands of American medical professionals. Soon thereafter, in 1962, Dr. Lown promoted and secured publication in the New England Journal of Medicine a series of articles cautioning against the grim realities of the nuclear age, describing in detail the synergistic effects of a hypothetical nuclear attack on Boston and the devastating consequences of thermonuclear war. Spurred on by the success of the PSR, he formed the International Physicians for the Prevention of Nuclear War with Soviet cardiologist Yevgeny Chazov in 1980, work which earned the two cardiologists the Nobel Peace Prize just 5 years later in 1985. Dr. Lown also helped to establish the Primary Prevention of War Group, an international collaborative group of academics and practitioners representing over a dozen universities that involves public health practitioners and teachers in anti-militarism activities and lobbying. Further, he mediated cross-border discussions between colleagues and journalists in Pakistan and India to diffuse tensions over nuclear armament buildup. In addition to all of these incredible humanitarian contributions, Dr. Lown was also an early advocate for actions to prevent climate change, calling it the monumental challenge of our epoch. In the face of each of these challenges, Dr. Lown found a call to action and a reason to hope. As he proclaimed during his Nobel lecture in 1985, the reason, the creativity, and the courage that human beings possess foster an abiding faith that what humanity creates, humanity can and will control. Thank you.
Thank you so much, Professor Kate. Let me close by making some remarks about Dr. Lown's time here at the School of Public Health. He joined us in the 1950s in the Department of Nutrition. So in the building next door, downstairs, that's where he had his labs, and he conducted research on cardiac arrhythmias and invented the defibrillator. During his 5 decades on the faculty, he trained many clinicians in cardiology, but he was always bothered by the fact that many of these clinicians decided to stay in the US and left their own country. He related to me many times how he was bothered by US having more Ghanaian doctors than Ghana. So when upon his retirement in the early 2000s, he was told that he has a substantial sum of money left in the school from his research funds, he decided to establish a scholarship program for mid-career professionals from developing countries to work on cardiovascular disease prevention. And that's how the Lown Scholars Program was established in 2008. Currently, the Lown Scholars Program supports 86 mid-career professionals from 23 countries, and they have conducted more than 3 dozen cardiovascular disease prevention programs in their home communities. Each year, Dr. Lown welcomed these Lown Scholars in his home, and often the Lown Scholars related to me that visiting Dr. Lown for often 2 hours was the highlight of their trip to Boston. We look forward to welcoming the next group of Lown Scholars in 2022, and I'm sure they will appreciate having this portrait as a reminder of his legacy. So now we'll unveil the portrait. The portrait was commissioned by the Lown Institute and was painted by Harvard alumnus Steve Coit. Okay, please. Okay. Wow. Dr. Lown was very fond of the painting which is in the background, which shows a traditional healer paying very close attention to his patient. The painting was hanging in his own living room. And again, I hope this portrait will be a reminder for all of us every day of Dr. Lown's unwavering commitment to health, both for the individual and for the populations. Thank you so much.